So I always use the opportunity to look glam in hair and makeup after a photo shoot to record a couple videos. So today we're going to talk about post-operative instructions after plastic surgery. So first of all, after you've had a general anesthesia, you're going to be very groggy and out of it for at least the first 24 hours. So don't text anyone because they're going to think you're on drugs, which you are, and you might be nauseated. The anti-anxiety medication that we give you, called lorazepam, it helps with nausea, and we're going to recommend that you take it the night before surgery. It'll help you relax and get to sleep. Also the day of surgery, when you are in the car on the way to wherever you're having your surgery, whether that's our office or the hospital or a surgery center, take one Ativan lorazepam pill with just a baby sip of water. That way your stomach is still empty, but you're more calm and relaxed. And the more relaxed you are, your veins are open, the IV will slide in more easily, and you'll just have a better time overall. And remember, after surgery, lorazepam is a little bit of a wonder drug. We give it to everyone. It helps you relax, it helps you sleep, it helps with anxiety, and it also helps with nausea. And it's actually a drug that is given often to chemotherapy patients before chemo. And it's fine to take all of your medications, including the lorazepam, the pain pills, and the antibiotics. For pain pills and antibiotics, you want to make sure that you have food in your stomach before you take either of those. Because if you take pain pills or oral antibiotics on an empty stomach, they will often cause nausea. And even if it's just a couple of crackers, that will help. The first night after surgery, try not to have anything too creamy or too spicy. Again, you might be nauseated, you might see it again. And say you take your pain pills or your antibiotics and you are nauseated and you throw them up, I would recommend that you just take it easy, maybe take an Ativan if you haven't already. Try to eat something, and then you can always skip one dose of antibiotic or maybe try the pain pills later on when you're feeling well. After any plastic surgery procedure, heat and ice is a big no-no. You know, you often hear about having a sports injury or an orthopedic surgery and you're supposed to ice it continuously. Ice does not mix with plastic surgery. And the reason for that is with plastic surgery, we're making an incision, we're often rearranging the body or putting in an implant or doing some very delicate work, and we need normal blood flow and normal circulation for healing. If you have ice on board, that will limit the blood flow to the area, it could interfere with healing, and it could increase the risk of complications. So ice is a big no-no. Likewise, heat is a no-no because you're numb and you could get a burn. So the main things to do after any plastic surgery procedure is rest, and that means getting your heart rate and your blood pressure up. To compress the area, say we've done breast surgery, you'll wake up wearing an ACE wrap. If we're doing any abdominal surgery, you're going to wake up wearing an abdominal binder or possibly a compression garment. And time. And know that swelling will peak at around day 2 or day 3 after surgery. Please don't weigh yourself for at least 6 weeks after a big surgery like a tummy tuck or full body liposuction, because you'll be really swollen. You'll step on the scale and go, and be plus 5 to 10 pounds of water. So know that your body will swell. And when we're doing full body surgery, something like full body liposuction, know that there's a condition that's called third spacing, and it happens anytime you have a full body injury. All the fluid that you take into your mouth, it'll enter your stomach, but then it goes into your tissues, and that's called edema. And that's why you can be plus 5 to 10 pounds of water, but still be relatively intravascularly dehydrated, meaning your blood vessels will be empty, and that's why you can have a low blood pressure or sometimes be dizzy or lightheaded, especially if you're lying down. If you stand up right away, your blood pressure could drop, and we don't want you to feel dizzy or to pass out. So the one thing you want to do is drink as much fluid as you can. Eventually, after about day 3 or day 4 or day 5, your body will start to mobilize all that extra fluid. It'll leave your tissues and it'll re-enter your vascular system, and you'll start to pee fluid out like crazy. But you don't want to limit fluids, and you just want to drink as much as you can. Lots of clear fluids. You also want to keep your blood sugar up. Something like coconut water is natural and helpful. Ginger ale or Sprite or a little Gatorade can help, because we don't want you to get hypoglycemic. That means a low blood sugar, and you can often feel nauseated or dizzy if you have a low blood sugar. So keep your blood glucose up. Also, after any plastic surgery procedure, that is not the time to diet. You need good, healthy nutrition for healing. You want to feed your wounds good building blocks so that you can heal. It's not the time to restrict calories and not the time to restrict any nutrients. Lots of extra protein is helpful. And I usually say if you're going grocery shopping, you want to go grocery shopping around the periphery of the store. The dairy, the meats and other proteins, the fruits and the vegetables. Try not to go down the aisles to get packaged goods unless you're going for one particular thing. And try to be able to identify all the ingredients of what you're eating rather than having pre-processed or packaged foods. You want to get lots of rest. And you don't want to sleep too much during the day, because if you nap all day, then you won't be tired at night. Often you can have insomnia after surgery and just feel like, oh, the wheels are turning. Sometimes that's the pain medicine, and just sometimes your body is just working on overdrive because your body's busy healing. So rest, meaning don't get your heart rate and blood pressure up, but try not to nap too much during the day. And you might find after a really big surgery, like a big breast cancer reconstruction or a tummy tuck or full mommy makeover, you just like hit the wall at 2 o'clock and you're just like, oh, I can't even stay awake. Don't fight that. Take lots of rests. Lots of breaks, but you're not on bed rest. Every hour or two that you happen to be awake, you want to get up and stretch your legs. Walk around your house, go into your backyard, but you're not going to be going for long walks or hikes for at least 3 or 4 weeks after any major plastic surgery procedure. The only major complications that can happen after you wake up, after you've survived surgery, surgery is very safe. And we will always have control over your ABCs while you're asleep. That means airway, breathing, circulation. If you're having a general anesthetic, there is a board-certified anesthesiologist present, and safety is number one. So when you're at home, the only potential complications that could happen is if you're not getting up and stretching your legs and moving around, a blood clot could form in your legs. That's called a DVT, or a deep venous thrombosis. We protect against that during surgery with double coverage. We have tight white compression stockings and special pumps on the legs, and they take the action of the muscle pump while you're asleep. Those, you will go home with the compression stockings on. You don't need the pumps anymore when you wake up, because then your own muscles take over. But we want you to get up and stretch your legs every hour or two when you're at home. Also, if we do a really big surgery, we're maybe in the abdominal area or in the breast area and you're feeling tight or sore, you might feel like you only want to go and take little shallow breaths. We want you, for every hour that you're awake after surgery, to take 10 deep inspirations, a great big, as if you're blowing up a balloon. And if you have surgery in the hospital, you'll often have a little machine. It's called an incentive spirometer. It looks like you blow into it, but you actually inspire and you go, and there's a little gauge, and it'll tell you how much you're inflating your lungs. The average vital capacity of a woman is 4,000 cc's. And the average vital capacity of a man is actually 5,000 cc's, or 5 liters. Very often after surgery, you'll only get it to about 1,000 or 1,500. Eventually, if you are sent home from the hospital with that, we want to get you up as high as possible. So taking 10 deep inspirations, if you're blowing up a big balloon, is really helpful to keep your lungs inflated, keep all those little air sacs called alveoli inflated, because if you were not to take a deep breath after surgery, eventually you could develop a pneumonia. So exercise your lungs, exercise your calves, but we don't want you to exercise your whole body. And the reason for that, the reason why we don't want you to get your heart rate and blood pressure up, is that after any major surgery, you have increased blood flow to that area, and that just happens naturally. Eventually, the blood supply will go back to normal. That takes up to 3 months. But during that time, if you get your heart rate and blood pressure up, it'll deliver more blood flow to the area. Theoretically, you could have a bleed, which is called a hematoma. You will prolong your swelling, possibly increase your bruising, and why do you want to do that? You just had major surgery. So take it easy. We want you to rest. You have time, you have compression, and you may have heard about the orthopedic RICE acronym, rest, ice, compression, elevation. Well, I agree with rest, as we've talked about. We don't want any ice, we've also mentioned. Compression, we can compress some areas of the body, but we can't compress everything. And then elevation, elevating is maybe what we did with a breast lift, but really what you have is time. So eventually you will feel like you're back in your groove, like you're doing well, but that can take at least 2, 3, 4 weeks after any major surgery, up to 3 months for much of the surgical swelling to go away, and up to a full year for the scars to mature. Which brings me to scar therapy. For most of our surgeries, with the exception of anything involving the mucosa, so if we do any intraoral surgery, if we do a labiaplasty or nipple or areola surgery, we often don't do scar therapy because it's a very forgiving tissue and it tends to heal without a lot of scars. But for any surgery in the skin, facial surgery, breast surgery, body surgery, liposuction, we do need to make some incisions. And anytime we make a full thickness incision, you will heal with a scar. For the first up to 6 to 8 weeks after surgery, the incision is really considered a wound, and there's really nothing special to do for most wound care. It wants to weep a little bit. Sometimes we have some absorbent pads against the area. If we want you to do dressing changes, then we will send you home with extra pads after your first follow-up visit. But in general, there's really nothing special to do for your incisions. When we feel that you are ready to start scar therapy, and that means your wounds are no longer weeping fluid, all the scabs are gone, and your body has started to deposit collagen, then your wound is considered a scar. And initially after surgery, your body deposits immature scar tissue or immature collagen, and it tends to be thick, sometimes red or raised. Sometimes it can be itchy or painful, but it's thick and it's a very strong wound, and that's normal. And scars tend to be the ugliest at about 3 months. Eventually, over time, your body naturally turns over that immature collagen and it makes mature collagen, which is softer and flatter. It's more faded. And I usually say it's kind of like your ear piercings. It's soft and squishy. If you have any other scars, you can look to them and say, oh yeah, that's how I heal. And it takes at least a year, sometimes longer, for your scars to mature. So when you're ready, we will have one visit where all we do is talk to you about scar therapy. And scar therapy consists of massaging the scars, using a topical scar gel, which contains medical grade silicone. It's similar to what we use in the burn unit for burn scars, and it also has SPF 30 sun protection in it. We'll have one visit where we teach you about how to paint the scar gel on, usually twice a day. For some areas that are thicker, sometimes we really want you to get in there and pinch it and massage it. And other areas we just say, paint it on and then forget about it. But the main thing is, if you tan easily, like I do, if you have an oven burn, I have an old one that's fading, it's over a year old, sometimes if you have darker skin or if you tan easily, you can deposit more melanin while you're healing. And that's called post-inflammatory hyperpigmentation. And depending on your skin tone, I might tell you at the first consultation, oh yeah, your scars will be darker and they will take often several years to fade. The scars, we try to hide them in natural body creases or in your undergarments if possible. But some scars, for instance, around the belly button and a tummy tuck, or say we need to make little liposuction incisions, sometimes they can be darker for several years. And you just had all this surgery done, you want to wear a bathing suit, and all of a sudden you're like, oh no, I have all these little dots. So we have special tools and tricks that we can recommend for scars that have not yet faded, if they're a little bit darker or a little bit more obvious when that time comes. And we want to make sure that any questions our patients have along the way, you let us know. There's no such thing as a silly question. All my patients have my cell phone number. I'm always available by text. You'll get the cell phone number at your preoperative visit. And as I said, no question is too silly or too small. If you're asking a question, that means that you don't know the answer and you want to learn. And I would rather that you ask Dr. Horton, not Dr. Google. And you can really freak yourself out by doing internet searches rather than just ask me. I can answer your question in 2 seconds. So hopefully this information was helpful. If you have other questions, contact us. For surgical patients, we look forward to taking care of you. We want to make sure that you will have the best experience ever. And if there's anything else we can do to support you or answer your questions, just let us know. We'll see you again soon.